Is keeping a close eye on different models and statistics to decide when to reopen schools and businesses. But this particular virus presents some unique challenges in tracking some of that data. Here's News 13's Gabrielle Burkhart.
Two of the factors we keep hearing about are rate of spread and test positivity rate.
With case counts coming down, our test positivity rate is coming down back to, our target's 5, but I think we all feel more comfortable. And I know the governor feels more comfortable if we're below 4, and now we're down to 3.5. That's good news.
That was Human Services Secretary Dr. David Scrace during the most recent news conference, referring to the percentage of positive tests based on the number of tests administered. In a July 30th news conference, the state showed this graph using a 7-day rolling average. It shows overall our positivity rate is better than much of the nation's. But that number also varies by location, with some places like Bernalillo County doing much more testing than smaller counties like Lee or Union counties, where positivity rates can be much higher. Who these testing clinics are targeting and who's choosing to get tested can be variables. New Mexico is also looking at virus spread rate, which is a formula used to determine how many direct infections are caused by someone with the virus. Our state has a target spread rate of 1.05 or less, and we've stayed below 1 over the last couple weeks. But the fact that there are so many asymptomatic carriers of this virus make for some unique challenges.
So what we do to try to minimize uncertainty is we consider a range of possible values for those asymptomatic folks to try to understand how important that factor is in our model outcomes.
Now, the team at Los Alamos National Lab is working with local and federal partners to help track COVID-19 data. Their mathematical epidemiologists say it's important to look at multiple models to get the best picture of where we stand.
If you're looking at one model, you may not be seeing the whole picture, but when you're looking at a compilation of models and all of them agree, it seems like the state is probably doing, the best that it can do.
Now, the governor's office says it'll factor in county positivity rates to determine whether to allow socially distanced visits in long-term care facilities. Back to you.
Okay, thanks, Gabby. Now, right now, 21 counties in the state have a test positivity rate under that 5%.